Good morning, colleagues, all. We're sorry for the late start. We have today with us Dr. Lynette Peters from the Ministry of Health, Director of Veterinary Public Health in that unit. We also have with us Dr. Gillian Ellis and Dr. Susan Miguel from our Veterinary Services Division. We have with us also our Principal Director, Ms. McLean. We are trying to see how we all can work this thing through together so that we can all keep safe and to prevent spread. So I will hand over now to Dr. Peters, who will give an overview of the situation we are in, the preventative measures you can take. We'll be taking questions. We'll be in a question and answer session at the end of it. And please feel free to ask any questions you want or any concerns you want to share so that we can try as best as possible to resolve these issues. So Dr. Peters, over to you.
Okay, thank you, Dr. Watson, and good morning, everyone. It was not really planned for me to be here this morning, and so I was hijacked by Dr. Watson. Nonetheless, it is certainly a pleasure to at least share with you what we know so far of COVID-19. No longer are we referring to it as coronavirus because since it has been specifically named, as well as to answer your questions regarding the Ministry of Health's response to this virus that we never thought would have reached here so quickly, but nonetheless, it's here. This one's... It's not on Central? Yeah, there. Okay, so it's not good. Oh, okay. One second.
Can you just ask them if they can see your screen?
Okay.
Mm-hmm.
Yes, are you all seeing the screen?
Are you able to hear from?
Are you all hearing me? Can someone indicate? I can't hear if anyone is responding.
Yeah, the chat.
Yes, the chat.
Click on the chat. More, going more.
Also, we still.
Yes,
Okay.
can see and hear.
Okay, can you hear us now?
Can you see the screen?
Can you see the screen and hear us? Can you indicate whether or not you're hearing us just by the raise of a hand or to say something? All right, thank you. Thank you. Okay.
Okay, so we need to go back. Oh, okay. Okay. So the brief presentation today will give you a brief overview of what is coronavirus, how it is spread, the incubation period, a little bit on treatment. As you may very well have heard, there's really no treatment. Who are the persons most at risk? Some general precautions and preventive measures, and some consideration or tips for you in the workplace. I'm not sure if the video that the World Health Organization has provided to ministries of health in all countries will show, but I will try, not having had the opportunity to go through this before. So what are coronaviruses? This is a large family of viruses found in both animal and humans. And interestingly, I'm sure some of you may have heard about bird flu some years ago. That virus also belongs to that group. They're known to cause illnesses ranging from the common cold to severe diseases. SARS, yeah, I'm sure many of you have heard about SARS, and we had to take measures here in Jamaica to prevent and to protect against SARS. So it is just one of the respiratory diseases that is caused by a coronavirus. This is, of course, a novel coronavirus, and novel because it's a new strain that has never been identified previously in humans. This novel virus, was detected first in Wuhan, China, in December of 2019. On the 30th of January, the World Health Organization declared COVID-19 a public health emergency of international concern. And why this declaration was done is because the organism, the disease had spread to all the health regions of the world, the geographic regions, so all the continents were showing cases of the disease. On the 31st of January, Jamaica started restrictions on the travel of persons coming from China. Later on the 27th of February, we decided to add South Korea, Iran, Singapore, Italy. And since then, we've added several more. As you see, on the 12th, we added France, Germany, and Spain. And this is because at the time we were looking at countries that not only had cases of the disease, but also had local transmission. So it was not linked to persons traveling from a country that the disease was present or cases were seen. On March 10, Jamaica confirmed its first case of COVID-19. And of course, this was associated with someone who came to Jamaica and attended a funeral, apparently came with the disease from the UK. So that's the start of our problem here in Jamaica. Whilst we were trying to prevent it, at the time, UK was not one of the countries that we were restricting travel from, and hence those passengers were not screened in the same way as would persons coming from China and the other countries that were a restriction was placed on. COVID-19 is spread mainly by droplets produced when an infected person coughs or sneezes. So it is not a disease that is transmitted by contact. So if you touch someone, then of course they could come down with the disease. No, it has to be somebody who has the disease and coughs or sneeze, and that droplet, you come in contact with that droplet and it lands either on your nose or in your mouth, or you inhale those droplets and it goes into your lungs. So that's the main way you can be infected. Now, having said that, you will have noted that persons are walking around wearing masks. This is, of course, not recommended. Why? Because it is only recommended for persons who are exhibiting respiratory symptoms like coughing, sneezing. And so when they cough or sneeze, hopefully the mask would contain the droplets that may have an infected, a virus or something else. Also of note is that we are just in the close of what we know as the flu season. when we do have many more persons having flu and flu-like symptoms. So yes, we will have, and those we can only distinguish from the coronavirus if we test them. I do not want to go into testing yet, but just to note here that we cannot and will not be testing everybody who have respiratory signs and symptoms. There are specific criteria for doing those tests, not only because we would be overwhelmed with these samples from those persons, but we don't have the capacity to treat with those tests. Another important thing is that for the transmission of COVID-19 is that objects and surfaces can be contaminated by the droplets from persons who sneeze and cough. Someone who touches these objects then touches the face, nose, or mouth without washing the hands can get COVID-19. So yes, you may not necessarily be in the environment where somebody coughs or sneezes, but that person may have coughed and sneezed on some surface. You touch that surface and the virus can get, you can come in contact with it and it gets on your hands. And you know, it's very difficult not to touch your face several times a day. But this is a practice now that we need to avoid. Try to, each time you touch some part of your face, just remember COVID-19. So we know it's going to be a difficult thing for you to do, but the general population, we're hoping that the message will go across, because you never know when you have touched something that may have the germs, not only COVID-19, but generally. You know, surfaces are dirty because several persons' dirty hands come in contact with it. What are the main signs and symptoms of COVID-19? Firstly, fever, cough, shortness of breath. So anybody experiencing these symptoms, having a fever, cough, shortness of breath, this is what we're looking for. In addition to that, we're saying that having had those symptoms or displaying those signs, we would want to know whether you have a history of you have come back from a country that has many cases of coronavirus or COVID-19, or you were in contact with someone who came from there and is infected. So yes, you may have these symptoms, but they may very well also be associated with the common cold or influenza. We are not looking for persons who have no travel history and may not have come in contact with someone who came from overseas. Just to note as well that in severe cases, the infection may cause pneumonia, the inflammation of the lungs, severe acute respiratory symptoms, which goes beyond just shortness of breath, but also general difficulty breathing, and so would have to be placed on ventilators, and of course, even death. The virus has an incubation period that has been established so far. We say from the time of exposure to the virus to the time when you come down with clinical signs of the disease can vary from 1 day to 14 days. We are still studying the virus, so this may change. You may hear that the period is extended, but for now, this is what the scientists have indicated, that it takes 1 to 14 days for you to come down with the disease. And some may, based on their immune system or the load of the virus, that they may have been infected with may take a shorter period of time. So just bear that in mind, and you will notice that most of the restrictions we talk about 14 days, and it is because of this incubation period that has been established by the World Health Organization. Treatment, there is no specific treatment to prevent this disease. We are only treating symptomatically. So if you have a fever, we would just ask you to maybe take some Tylenol, and if you're coughing, the cough medicines on the market, the cough and cold syrups. And, but when it comes to shortness of breath, then you will need to be on a ventilator or something like that to make sure that you get enough oxygen in your system, you know, for normal survival and oxygenation of the cells. So generally, there's no treatment. Vaccine is being developed, but that takes quite a long time. And you can imagine Jamaica, when will we actually get even a couple doses of that vaccine? There are some persons who have been identified to be most at risk for this disease. And it is not unique to coronavirus, but persons who are over the age of 60 and older and have underlying medical conditions like diabetes, hypertension, cancers, lung disease, they are most at risk. What this means is that they are more likely to become infected if exposed to this virus, and will also be more likely that the outcome will be death. And so this is why we're saying persons in this group are high risk, and if they can avoid certain settings like crowded places, places where we will talk about later on that they can become at risk for this disease, avoid them. And know that if you become exposed to this virus and get infected, then you stand a less chance of recovering from the disease. Another important fact too is that children the disease tend to run a very mild course with them. They may have a little cough or a little runny nose or something like that, and generally respond to treatment. And so, and this is a unique disease because normally children are at high risk, but in this particular case, so far, it has been shown that children seem to carry the disease in a milder way than generally known. What are some of the prevention measures? And yes, what are some of the prevention measures? And I will speak later on about what you may, why Jamaica took the action that they did and to what benefit. First of all is the hand, we consider it a carrier of germs. And from this slide, you will see germs, different type of germs, what looks like bacteria, what looks like parasite, fungi. And so there are different organisms that is found on the hands, whether by virtue of you handling objects or so on, you touch things and surfaces, they are filled with germs or bacteria, viruses, and so on. So key preventive measure is to wash your hands as often as possible with soap and water. Wash your hands properly as often as we can to prevent the disease. During the day, we may touch paper, book, doorknob, table, and I was very impressed when I came in to the Ministry of Agriculture's building, most of the doors were kept open, so persons did not have to turn a knob before they enter, which could be a source of infection because the doorknobs do have a lot of germs. Tables. The table, our work table, need to be cleaned more often than we do. Vermilion should be wiped down cleaned down with some disinfectant just to reduce the germ. It may not destroy all, but at least it reduces the load. And we say once contaminated, hands can transfer the virus to your eye, nose, and mouth. And from there, the virus enters your body and make you sick. So yes, you touch these surfaces, know very well that you should not touch your hands, nose, your face, nose, anywhere, your nose, mouth or so, because you can transmit. And you see those people who like biting their fingernails and so on. That's not a good habit because you can infect yourself with the unknown. Washing your hands with soap and water after coughing and sneezing. When caring for sick persons, before, during and after you prepare food, before eating, after using the toilet, when hands are visibly dirty, and certainly after handling animals or animal waste. And you know, I want to stop there as mention is made of animals, and maybe because of my profession, I know that we have been putting out some flyers that is saying, you know, and with some egg and bacon, it's not really typical that you will get COVID-19 from any of those products. And so please bear that in mind when you see some of these ads. After handling animals, because you know animals, just like their personal hygiene, they don't bathe, they don't wash hands, they don't wash their hands after defecating or something like that. So yes, you wash your hands after you handle animals and animal waste, and it's not specific to COVID, but general hygiene practice. The Ministry of Health like to emphasize how you should wash your hands properly. And first you wet your hands with water, apply enough soap to cover all area of your hand, scrub the middle of your hand and back of both hands, your wrist, between your fingers and under your nails for 20 seconds. Not so how sometimes we just turn on the tap and we're gone. So carrying out this process, the middle, the back, between your fingers, the wrist, 20 seconds, carrying out this process. And then you rinse in running water, not in a bucket with water, in running water. Dry your hands with paper towel and discard that in the bin when you're through. Hand sanitizers, that's a sore point, and everybody has hand sanitizer. If you're using a hand sanitizer, use alcohol base with at least 60%, 62% alcohol. We say even 70%. But, and when using a hand sanitizer, ensure that you use the same motion that you use when you're washing your hands. That's rubbing your hands, the middle of your hands, then to the back of your hands, in between, and your wrist. And making sure, so it's not just wiping your hand with that hand sanitizer. Do not use a hand sanitizer if your hand is visibly dirty. Do not use hand sanitizer as a replacement for soap and water. So I just want to say here that the hand sanitizer has limited benefit if your hands are dirty. So we always recommend washing your hands with soap and water. That is the best thing to keep your hands clean. You can, the hand sanitizer can only reduce the number of germs on the hand if it is not as much, that is after you have washed the hand. But in circumstances where you may not have water, and if your hands are not visibly dirty, hand sanitizers can be used. Okay. Cough etiquette. I know this is another difficult one. We ask you to cover your nose and mouth with tissue paper when coughing or sneezing. We know that sometimes the cough is impulse, and on an impulse, you really don't even realize that you're going to cough. But if this happens, if you cough, if you are able to do it sudden and you can, pull your clothes and inside whether in your arm or inside your clothes, then to reduce the spread of the droplets all around. But remember, wherever you sneeze, whenever you sneeze or cough, wash your hands with soap and water afterwards. And sneezing is a good way of spreading that virus because it is spread in droplets, in the droplets of that sneeze. And so we're continuing to ask you, Ministry of Health is saying, avoid touching your nose, eye, and mouth, and when your hands are not washed. At this time, when we are now seeing many cases of coronavirus, COVID-19 in Jamaica, we are encouraging you to practice social distancing. What does this mean? That at least stay as much as 3 feet from the person you're interacting with or the next person, 3 feet or 1 meter. That's the approximate distance we're saying you should try to stay away, especially from somebody who is displaying signs of respiratory symptoms, sneezing, coughing, and so on. You know they have a cold, you stay away. We ask that schools and other gathering places be closed because, one, this is a place where people sit closely. Even your meetings, and church services, we ask that some of these, where possible, can be canceled. And it's also good that we can communicate via Zoom or what is this? Webinar. And so you can be in the comfort of your home and be able to communicate. And likewise, you can do your school work from there and so on. So it is where we can use those mediums to communicate and to not necessarily to meet with people directly, then these means are encouraged at this time. So avoid close contact with persons with flu-like symptoms, stop the hugging, kissing, shaking of hands, and maintain the 1 meter, 3 feet between each other. Social, when someone is coughing or sneezing. So the social distancing really applies to persons who you see having respiratory signs, coughing, sneezing, and so on. We also, in order to maintain social distancing, we also say if you are sick, we encourage you to stay home. And if you are going out, it's only if you are seeking medical attention. keep children home when they are sick. And now we're saying you yourself, even you're working, if you're you suspect you're ill or you feel ill, stay home. And if the illness is, the symptoms are so severe that you cannot cope with it anymore, then go and seek medical care. You can go to a private physician or to one of the health centers or hospital. Some hospitals, they will have signs up for persons who are showing respiratory or coming in as a result of respiratory illness, that they go in a specific area, knowing fully well that at this time we are looking for patients with COVID to isolate them and to contain the spread of this disease. So, do I need to wear a mask? The answer is the use of masks by the public is not encouraged. Practicing good hygiene is a critical way to protect yourself and others from respiratory illnesses such as coronavirus. Just in addition to that, the Ministry of Health would only encourage the use of masks if you're displaying some of these symptoms. You're coughing, sneezing. The mask will contain these droplets, reduce its spread around. So it's only the sick persons who should wear the mask. And of course, the healthcare providers who a sick person may come in contact with. But the general public, it is not recommended. You do so at your own pleasure. So we say what time you should wear masks. Healthcare professionals who are directly dealing with confirmed or suspected cases should wear the mask. Persons displaying symptoms of respiratory illness in the health facility may be asked to wear one as well. For schools, well, fortunately, the decision has already been taken for students, for schools to be closed, and most institutions have done so. These are areas and places where you have large gathering and persons in close contact, and this is why schools were closed. And this is one of the main means of containing or preventing the spread of this virus, because we know there is no way a child or so having this disease, the way they interact in the school environment makes it very conducive to the spread of this disease. So that was a decision taken in the interest of preventing the spread of this disease, knowing fully well that we now have some imported cases. And by now you would have heard that we have a total of 15 or 16 cases confirmed, and those persons some of those persons have been in contact with the imported cases. And so the likelihood of it spreading does exist. And we're hoping, I understand the minister is going to announce additional measures, and it is now being decided on. So I suppose we will hear about that later. In the schools, of course, and we can say workplace, cleaning the surfaces of desks and tables and the keyboard of these computers, the telephone, with disinfectant is advisable. And you say, what disinfectant? We're talking here ordinary bleach, about 5 or 6 tablespoons of bleach to a gallon of water, or 4 teaspoons to a liter of water, and use that to wipe down, or 70% alcohol can be used to do that kind of disinfection. For workplace, we promote regular and thorough hand washing by employees and the customers. So place hand sanitizing, rub disinfectants in prominent places around the workplace and refill them regularly. Display posters promoting hand washing, and the Ministry of Health has a number of posters. So, and unfortunately, Dr. Watson, but on your return, you can collect some from the Ministry of Health for distribution. And make sure staff and customers have access to places where they can wash their hands with soap and water. Now, the unfortunate thing is that most of our facilities where or buildings, the taps are hand operated. And so when you finish washing your hands, you still use your hands there to turn off the dirty tap. Originally, we encourage food establishments to all have foot operated or other parts of the body operated taps. So we are also going to say wash off the knob. Whilst you're washing your hand, do that wash and rinse it. Finish washing your hands and you turn off the tap. So that's the most we can do at this point in time. We are not necessarily able to install foot operated wash hand basins in all facilities. For workplace, keep the workplace clean, clean surfaces, desks, tables, telephone, keyboards, same types of disinfectant. When you're sick, stay home and not carry this virus around. Important for all employees at this time to have update their contact information for employees and their emergency contact. So in the event somebody is at work and start displaying these symptoms, they may very well be whisked off to the hospital or health care facility, and we would need to have, you would need to have an emergency contact. Who do I tell that Dr. Watson has been sent off, been taken to University Hospital? So yes, we need that emergency contact to be at your workplace. Any area where a person who becomes ill with symptoms can be placed before they are transported to the health facility. So also in all buildings, workplace, we are asking that at least an area be identified where if somebody starts displaying any signs and symptoms, and what are they? Shortness of breath, fever, cough, that they can be isolated, kept away from until they are transported to the health facility. Another strategy at the workplace is to keep businesses going. If a number of strategies must be identified if many of the persons or members of staff fall ill. So again, you know, think about it. Can persons work out of home or make the provisions, buy enough computers so persons can maybe work out of home? And there are many techniques, and as we're using here, video conferencing and so on, may very well be what we will have to resort to. And flex hours to avoid peak public transportation time and crowding of workplaces. So there are some measures that, and you can also think of others, but this, for the time being, this is what Ministry of Health is suggesting. reinforcing the stay home when you're ill. We know persons will abuse this even when they are not ill, but we know that the normal thing is that you can stay away from your workplace up to 2 days, and then on the 3rd day you will have to take a medical certificate. So that policy, I think, still apply for government employees, but certainly we ask you, especially if you're showing any of those signs and symptoms of respiratory illness, to stay away from work. And if anybody is showing any of those signs of symptoms and is at home, you are at liberty to call the Ministry of Health hotline or go to see a medical doctor, and the necessary referrals will be done. In each area, if you're in the building, an area should be identified for ill persons that meet the following criteria. So if persons are sick, the area needs to be well ventilated. I am also concerned about the use of air conditioning, the air circulating in a confined space, so that if we can open the window, get fresh air circulating, that would be a good way of reducing the risk of transmission, person-to-person transmission of this virus in closed setting. Temporary areas, a temporary area until health department is called and the person is transported. We did say that already. Again, for travels, there are points of entry based on the international health regulations that we're enforcing. There are countries that we're restricting travel from, and we're still doing so. And in keeping with the objective of the international health regulation, we must ensure that maximum security against the entry and spread of the disease. And so seaports and airports, we have staff there monitoring both persons coming from countries that we have restrictions placed on, and countries and individuals who have come in. Non-Jamaican nationals are being returned, held in a space at the airport and returned from those countries. Jamaicans, we will have to accept them. They will be examined, temperature taken, and so on, and sent straight to some restricted area, whether it's a hospital or home quarantine based on assessment. For Jamaica, we try to have all the ports equipped with these temperature scanners and so on to try to detect sick travelers. But of course, some will pass through. And there at all the international airports, there is an isolation room that has been earmarked for keeping persons who have been identified or as having signs and symptoms of the disease or are being held to for return because they are coming from countries that does not meet or are restricted in terms of travel relating to COVID. If you're going to a country, if you're traveling to a country with COVID-19, and I know, it's not about if, because we still have many flights going to the United States, which is close by to us. We certainly are not recommending for you to travel, but if you have to, then if you're going to an affected area with the virus, you need to take certain precautions. Again, just making sure that you do not make contact, social distancing, making sure that you wash your hands frequently with soap and water. Do not touch surfaces and touch your face, and so on. And before you travel, you can seek information, up-to-date information on COVID-19. There is a World Health Organization website that you can get up-to-date information as to the countries and the places where cases of COVID-19 and the number of cases, number of deaths of COVID-19, of persons with COVID-19, so you can decide whether or not you really want to go. So we're asking you to stay healthy while traveling. Cover your nose and mouth. We cannot overemphasize it. There is this video, and I just also want to, I'm not sure if it will come up, but whilst somebody try to see if they can get onto computers on the internet. Yes. Just to note here that COVID-19, we still do not know the origin of this virus. There has been one case of a dog that tested positive for the COVID-19 virus. They isolated it from the nasal swab, oral swab, and the rectal swab. And this was reported on about the 26th of February. The dog is owned by a patient who was hospitalized for COVID-19. So the person was in hospital, the dog was tested. The dog was not ill, does not show any signs of the disease, and is held in quarantine. And it was retested 5 or 6 days later. The virus was again isolated from the nose and mouth, not from the feces this time. So it is that subject is being studied. That's the isolated case that has been reported to the World Animal Health Body and is being investigated to see if there is some possibility of transmission of this virus from humans to animals and vice versa, and the implications. So for now, there is no reason to scorn your animals. We still do not know the source. The origin of the virus, yes, it was found on the environment where certain seafoods were sold in China, and we haven't heard much more about the origin. Dr. Watts, do you have anything more to add in terms of the human-animal link at this time?
Yeah, well, it's just a wake-up call to all of us based on the preliminary information that is available, that it might have come from some interaction with some form of bats. We know that several of these emerging diseases have been coming in from the wild, and you go back to chickpea and zigbee and Ebola and others, but try to stay away from the wildlife and the wild meat, and from going into areas where you have a lot of wildlife, where we don't know exactly what's happening in there, because that is where the interaction takes place. And possibilities are that is where you do get a lot of the so-called emerging diseases. So we have to be just careful and ensure we have a practice here of persons smuggling in exotic animals. When you see them, you report them to the police and out to us and let us ensure that we keep all of us safe. That's pretty much. So you're ready for the video now?
I'm going to share this now. Yeah, I want it.
It's shared.
Yeah, man.
Okay,
Yeah, man. Say one.
okay, go ahead. Yes. Sound? Is there sound?
Is this the video? Well, maybe what we can do at this time, we can maybe take questions. I'm not sure if the video is showing.
No, my video is
Is it?
I'm
I'm not sure.
not sure this is the video. Okay.
Because I.
When coffee There are several measures you can adopt to protect yourself and others from getting the new coronavirus. Frequently clean your hands by using an alcohol-based hand rub product like a gel, or wash your hands with soap and water. When coughing and sneezing, cover your mouth and nose with flexed elbow like this, or use a tissue. If you use a tissue, discard it immediately into a closed bin. Avoid close contact with anyone that has fever and cough. And if you have fever, cough, and difficulty breathing, seek medical care early and share information about any recent travels with your healthcare provider. If you just have mild respiratory symptoms and no specific travel history, carefully follow the precautions I just explained and make sure you stay home until recovery. If you need more information on how to protect yourself from the new coronavirus, check the WHO website at who.int.
So we can take questions and at this time. Is there are more videos, isn't it?
Aaron?
Yes.
And bring.
Are there some more videos?
Will they be able to speak? We can hear them.
I should be able to.
You can allow them the option to speak.
Allow them to speak.
Go to the participants,
Participants.
attendants, click on attendants at the top.
All of them are muted.
Yeah, click on them. Click.
I'll click on it.
So somebody put their hand up.
Yeah, I'll click on this.
Allow to speak. Allow to talk.
All right, call the person.
Yes, go ahead, Sharon.
Maybe she had her hand on her earlier.
Mute. It says mute.
No,
Sharon is muted.
it's not. Mute
Okay.
it, and take her hand.
Hello. Yes. Are you hearing us?
Mute, take her hand down. Go back up.
Hello.
Go back up. Okay.
Unmute.
Click there and take her hand down. Lower her hand.
No.
Lower her hand. I think she had her hand on before.
No, Dr. Peters, could you explain, we mentioned about the mask, people wearing the mask in public, but we also see people with the gloves on in public. Can you go through and explain the use of the gloves and if that's beneficial to anyone?
There's nothing wrong with wearing the gloves, but the unfortunate thing is that it provides a false sense of security. There are two problems here, is that the gloves,
No one sees. Don't come from this.
you touch several surfaces with it. You may accidentally touch your face which is not recommended. And also, when you remove the gloves, you need to remove it properly and to make sure you wash your hands with soap and water immediately you remove your hands. So it should not be considered, it's a false sense of security to wear the gloves, and if you don't wash your hands after removing, and there is a special way of removing gloves so you don't touch the outer part of it with your hands. But even so, you have to wash your hands with soap and water at the end of it. The same thing you would do without wearing gloves. So yes, you can wear it, but just remember that you would be at risk just the same if you remove the gloves and not wash your hands with soap and water, or you use the gloves and you touch parts of your face. You can place yourself.
But in addition to that, Dr. Peters, you have, I've seen a lot of persons, they are wearing one dirty pair of gloves from their leave home or wherever. They go to the supermarket, they touch everything on the supermarket shelf. And so that is why the Ministry of Health is saying, you know, it is not recommended for you to wash your hands. I mean, you know, the supermarkets and most of the other retail outlets now, they have some sanitization practice at their establishment. So when you go there, you actually have someone, you know, offering you some sanitizer. Use that instead of trying to use this dirty glove going around and contaminating everything. That's the next question. Miss McLean, you want to answer that one?
Sorry, what was the question?
It's how will leave of absence occasioned by staff being asked to stay home for specific time period be treated?
Okay, so if the government of Jamaica has mandated, right, if the government of Jamaica has mandated members of staff are quarantined, the ministry will allow you to go off, but write to the Ministry of Finance to have special leave approved. No, they don't need to look at that. I hope I answered that question. Question was answered?
That question is asked by Clarence Frater.
Yes. Mr. Frater, did I answer the question? He can tell. Oh, he didn't hear.
Didn't hear the answer. Oh, you want to repeat it?
We should be able to hear.
Are you hearing us now? Are you hearing us now, Mr. Frater? Oh, okay, so I'm going to ask if Ms. McLean can just repeat.
Maybe he's hearing from this and not this. All right, so Mr. Frater, what I was saying is that if the government of Jamaica has mandated that members of staff or persons from a certain community be in quarantine, that the Ministry of Industry, Commerce, Agriculture and Fisheries will allow you to go off and seek to have special leave approved for you. Because it's not like it's your fault. You're asked to be quarantined, and so we will follow suit. And or if you're asked to stay home by the Ministry of Health or any medical practitioner, once you're aware of that, we will seek to have special leave approved for you. But you must communicate to the HR division, right? Don't just go off and expect that we will know where you are. That communication must take place.
Reinfected. Yes. The question by Nicola, is it possible to be reinfected by the virus? Currently, the virus is under study. There has not so far been cases of persons who have had the virus becoming reinfected. We don't know if there is sufficient immunity or antibodies built up, and so the person is resistant, having been re-exposed. We do not know at this time. The virus is still new. Okay. No.
Are there any further questions?
The question asked was what would be the response if you are experiencing symptoms of the disease and you call the Ministry of Health emergency lines, any of the numbers. One, your information will be contact information, name, address, and depending on what you have described as your symptoms, you will be referred to the doctor or the nearest health center or the hospital. When you get there, you will be examined, and if you are found to be a possible suspect, then you would be taken in, isolated, a sample taken, and the results, upon receipt of the results, you would either be now transferred to a treatment area, ICU, and in what ICU is what? Intensive care unit, and you'll be treated, and that would be, if you're not suspected of this condition, or you're positive, say, for influenza A, which has similar symptoms in some cases, then you would be just placed on the normal ward and treated. And if you're not seriously ill, then you would be sent home for treatment.
All right. Dr. Peters, there's a question. How can the virus survive on surfaces outside of the house?
How long?
How long? Well, we based on what the information that we have so far, it is said that the virus can survive many days, up to 10 days on surfaces. And so that's very long, because our knowledge of viruses, generally they do not survive for long outside of a living being. But this particular one, so far they have seen it survive for 8 days, some 10 days. And so we're not sure of the full extent, but say about 8 days.
There's another question. There are two more. No, go back. There's go back up. There's one higher up.
So just use this.
Yeah, go back up. You passed one.
This one?
Yeah, you had passed one. Go back. Back up. Okay, there. Well, okay.
To what extent is our ministry prepared to procure the requisite hygienic facilities to sustain our demand over time? Are we financially prepared? What is that?
I think it's our ministry, maybe.
Okay, so I think that's a question from Michael. Yeah. Well, I'm sorry that the PFO is not here, but I know that we beefed up or ramped up our requests for supplies of hand sanitizers and disinfectants, bleach, alcohol, and we have no budget. But the PFO, you know, we spoke about an emergency fund, and she has been in dialogue with the Ministry of Finance to bolster our supplies. So you will note that this is year end, fiscal year end, and cut off and all that, but I think the Ministry of Finance has been facilitating those critical cleaning supplies that we require.
This person is asking, what is the protocol of MyCap if a member of staff is diagnosed? I think maybe Dr. Peters, because we'd have to follow in what
Yes.
the Ministry of
I
Health.
want to take that one, Dr. There's something there.
Yes.
What is that?
Scroll down, please.
What is the protocol
Just scroll down.
for MyCap?
Yes, but
Member is diagnosed.
well, okay. What is the protocol generally of any? What protocol there is? The protocol would generally be that if a staff is diagnosed, it means that that member of staff would be in the care of the Ministry of Health at one of its facilities. What will be done, the Ministry of Health, however, will definitely do contact tracing. So the workplace, it has implication for workers, members of staff at that facility. They may be asked to go into home quarantine, and for those who are displaying similar signs and symptoms over a period of time, so they may be very well asked, all the contacts in that workplace or all the staff in that office, to remain at home and to report to the Ministry of Health. That would be reported to the Ministry of Health, and they be asked to either go to their private physician or health facility if they show signs of the disease, and they too will be taken into the Ministry of Health facility for treatment and isolation and treatment. Well, the Ministry of Health is now looking at, apart from other wards in hospital, to convert them to quarantine and isolation facility, maybe exploring with some hotels to get enough space, knowing fully well that there is a potential for this disease, if not caught early, to spread, and will require more hospital space. So,
and of course, Dr. Peters, in relation to the Ministry of Health protocol, if internally that person would have been diagnosed, then the Ministry of Health will take over investigation, come into the relevant department, identify the contacts, the immediate contacts, supervise the whole sanitization of any areas that that person would have been in the entire building, and to advise us as to when we could reopen such facility after they have completed their due diligence.
So just to add, the protocol, MyCAP's protocol is really the Ministry of Health and Wellness protocol. If you're infected, you call them, they will guide you as to how you should, what actions you should take, and then you in turn will communicate with HR. Just send us a little email, right? So we know what's going on with you and we can get the requisite leave approved. If you have, I don't know if the Ministry of Health issues any certificates for those persons who are ill. I don't know if you do that.
You mean medical?
Meaning if you have someone under your care, an employee, nobody knows where they are, something. Some kind of a to say that they are in quarantine or they're being treated. I don't know if you do that.
If we issue to the public, no.
To the organization.
To the organization, the individual would be issued with such a certificate, if requested, and that would be turned over to the organization in I suppose after they recover.
And that is why it is important the contact list that that HR sends out for you to validate your next of kin.
Right.
That should, in case someone has to be isolated by the Ministry of Health, that the next of kin can be contacted.
Right.
That's very important.
Right.
The contacts. So if all persons who have not yet done so, make sure that you update your contacts in terms of next of kin, telephone numbers, etc.
I think Ms. Hunter has her hand up.
No, there was another question about Miss Tracy Ann. A friend of mine came back from Japan on Saturday. She shared with me this morning, that coming through airport, her temperature was not checked, nor was any contact information collected. My question is, what is the protocol supposed to be at the ports? Dr. Peters, I think.
Yeah. Well, Japan has now been added to the list of restricted countries, and we do not necessarily have any direct flight from Japan to Jamaica, and it is therefore going to be critical. Unfortunately, we have to rely on the information provided on the immigration form, which countries you have been in the past 6 weeks. And if that is not completed and that information shared, then Ministry of Health staff would not necessarily be carrying out any checks on those persons. Having said that, if any such person is here that have come from country like Japan, and you may have heard that the death rate in Japan has doubled or tripled overnight, I think. And so this is a serious situation where such a person should self-isolate, and also for the next 14 days, and you yourself should be keeping your distance until, and report to the Ministry of Health, call the Ministry of Health hotline, emergency line, and report if you have any signs and symptoms, or go to the nearest health facility or doctor. You will not, that person will not be able to just go and have or request a test. There is no private lab that will do any test for COVID-19 at this time. So the person would have to be referred through the health facility to be able to confirm. So for 14 days, that person should stay away from other persons and self-report if there are any clinical signs of COVID-19.
Yes, and I would like to add also that remember that we're all in this thing together. And this person that traveled on Saturday, it is part of their responsibility based on the reports and the notification from the Ministry of Health in the media, and that Japan is on the list of those countries. That person is obligated to follow the guidelines as laid out by the Ministry of Health to help to safeguard themselves and the rest of us. So they need to be carefully assess their situation, and should in case they start feeling ill, to immediately isolate, get a call to the Ministry of Health hotline, so that the proper protocol, as was outlined by the Ministry of Health, can be followed. I see there's a hand up from Ms. Carol.
Yes, but before that, Dr. Peters, you mentioned the test that is conducted. Do the members pay for that test?
No.
Okay, because I know the US is just now getting that for free. People are paying for so that's good that Jamaica is covering the cost of the
normally
test
in these circumstances, any cost of testing in this type of situation is an emergency disease. The government of any such state
should pay for that. Yes.
And just to say here, for testing, the criteria for persons to be tested for COVID-19 is, apart from showing displaying the clinical signs, fever, shortness of breath, cough, they would have to either have a history of travel from a country that is known to have the disease, as well as now that we have the disease here from imported cases, be in contact with a person who has tested positive in Jamaica?
Did we answer that already? The protocol at the port.
That one?
Yes.
No, the work from home. There's one Ricardo Gale is asking, is the MOH encouraging work from home?
Yes, scroll down.
Yes.
That's where we were.
Right.
Mhm.
So, if we can.
Right. That's where we are.
Mm.
Is MOH encouraging work from home? Okay, that's from the Dr. Peters.
Well, each employer, in the interest of public health, can make those decisions. So where it is possible for persons to function and produce away from home, away from the workplace or from home, then it is certainly encouraged. The other thing is that the Ministry of Health is also, apart from encouraging you to work from home, they weren't asking any other question.
No.
Okay.
Well, for that,
But that decision has to be made and provisions made for this by the employer.
I think the NFA links into that because the NFA, National Fisheries Authority, is saying that they don't have the type of intellect, right? So
Right.
due to the fact that they don't have that.
Right, but just to add though, that we are in dialogue with the relevant authorities because the Prime Minister was very silent. He said business continues, but the schools are out. So we do not have the directive at this time to close our offices because that's what it will come down to if you're allowing everybody to work from home. So until we are given further guidance, because we're not averse to that. In fact, ICT, we have identified a team of critical operating persons, and we are in the process of loading on VPN and TeamViewer and other applications, webmail, just to ensure that should we close the offices, we are ready to work from home. But we cannot at this time tell everybody that it is okay to work from home, having not been given any such directive.
Yes.
And just say outside of the directive, if a particular employer, and I suppose in this case we're talking about Michael, say for example, the previous question asked, somebody from the workplace tested positive for COVID-19, certainly the ministry will take that decision and to make the necessary arrangement for persons to work from home.
Right.
They are also at liberty to institute a shift system where you have less person in the office and so on. But those decisions will be left up to the organization. They are just suggestions from the Ministry of Health. The employer will have to make those decisions.
Well, notwithstanding though, I'd like to come in, notwithstanding that though, I think the Ministry of Health reserves the right to determine whether or not a workplace will be shut down for any particular period of time until they are satisfied that the risk has been minimized or removed.
Right.
Now, in relation to the National Fisheries Authority, I think you'd have to just reflect based on what Dr. Peters had indicated earlier in terms of his sanitization, washing hands, etc. I noticed they're asking about gloves. If they don't have any gloves, what to do to protect themselves. You want to make one? Stuff at the outstations. Yes.
We do not have gloves. Okay. Regarding the question of not having gloves and have to, deal with customers there who are applying for whatever it is, permits or as the case may be, and again, you can use your hand, bare hand, but remember to wash your hands frequently with soap and water, or you can keep at your desk a hand sanitizer and sanitize your hands with frequency. But remember, nothing beats the good old washing your hands with soap and water.
Now, the Ivory is indicating that the bins at the New King St. Lucia office are open. How will that be addressed? I think the PS has put together a task force. I think an email was sent out on Friday, I think it was, to all of the heads of the various units to indicate where the needs are. I think that this needs to be sent to Ms. Sharon May Shirley for action based on what is required at the different stations.
Right, but I think we need to distinguish. If we're talking about the little tiny bins under the desk, like if you have a little paper to drop there, it's a different thing. Those are not normally like the big covered bins where we put certain garbage in. So we need to distinguish between them. Now that little bin, tiny bin under your desk, if that's the one you're alluding to, we will simply just need to, dispose of the garbage in that quickly if you're putting wasted tissue and so on in there.
And I would just maybe suggest that because no ministry or no workplace can retrofit all offices with closed bins.
Exactly.
What the idea here is that for closed bins, I'm sure it's mainly in the bathroom or toilet where you have those bins. We would recommend that the bins be closed, and be foot operated, not so the tissue can be discarded there. It would almost be impossible to retrofit the offices with those closed bins, but that would be the recommended type of bin, to put garbage that a sneeze or cough or something like that, such a tissue.
But again, the managers at these facilities need to assess the situation to ensure that as much as is possible, the staff is safeguarded. So I think what needs to be done is that the supervisor or manager need to assess the situation there to see where those closed bins should be placed and where the need is. There's another.
Somebody's saying thanks for the
okay, you're welcome, Lily Claire. T-Shore Hewitt, your question is how the persons who have been tested positive to coronavirus responding to the treatment. Dr. Peters, you want to?
Well, so far, they have been responding quite well. Most of them are stable, as the latest report I had up to Saturday when I was in the Emergency Operations Center. Fortunately, we haven't had anybody succumbing to the virus so far. And we have to knock wood because in many other countries, the situation is different.
So Lily Claire, we see your question there. A number of my staff have had secondary exposure to someone who had no visible symptoms. Is it safe to assume that if the individual is symptom-free after 14 days, will they be considered clear? That's a very good question.
Yes, yes.
The thing is, and I want to add that I've seen where, well, the incubation period goes up to 14 days from now. It's a new virus, and we have heard of potentially 21 days. We don't know how
we don't have that.
We don't have the scientific
that information.
Right, but notwithstanding, it is always good to be alert, and even if after the 14 days, such persons may come down with symptoms, it is in their best interest to seek medical attention.
Remember as well that the virus is not transmitted by contact, and what we would recommend for that person, even staying away. So this is where your staff, if you were had secondary exposure, we would recommend that you may wish to ask that staff to stay home and self-isolate for the 14 days out of an abundance of caution. And if during that time he or she develops symptoms, then of course then they will be treated as a possible suspect, and the process of taking into a healthcare facility will chip in. But you can also make the decision based on how strong the case is for that person to stay away from the workplace during this time and self-isolate and report immediately if they show any signs and symptoms.
No, thank you, Doc. No, Ivory, I think, well, you're saying
which question is she?
Would the office be closed for sanitation? I mean, I'm not
office?
clear,
Yeah.
but what is the MICAF response?
To what?
No, okay, so you're assuming that if, God forbid, somebody might have tested positive and the offices are closed for sanitation, then fine, I can understand that question. Yes, the office will be closed for sanitation. But for now, we are not aware of any case within the Ministry of, within MICAF. And so therefore, there will be no need to close an office for sanitation. It's just for us to practice good hygiene and sanitation, ensure that the doorknobs are clean and sanitized frequently during the course of the day. You wash hands, you don't touch your face, just as Dr. Peters had indicated earlier.
Okay, and we just want to say that, maybe the ministry could impress on the cleaning staff to be much more diligent in the work that they do, because even though they are supposed to wipe off everybody's desk every morning, it's sometimes they do this one, they don't do the other, or they do none at all. So it's just, again, impressing on the staff for their general cleaning and make sure the doorknobs are cleaned and so on, which they don't normally do.
So Mr.
Okay, thank you, Mr. Freighter. We see you appreciate for the sharing. Go on to the next question from Tariq Richards. Good day. How do you deal with a staff who may have a critical illness, and for preventative measure, it would be best for them to stay home? Will the same measure apply as if you are quarantined?
This is an illness that is not COVID.
No, so this one, I mean, because normally persons over a certain age, or persons with chronic illnesses, that they might be at a disadvantage should in case they get infected with COVID-19. So I think they're trying to find out. Yeah.
So I'm going to allow Dr. Peters to respond, but from the ministry standpoint, if you have any regular illnesses, your regular sick leave will apply. So you can stay away. If you're talking about going into quarantine, so you're not sick, but you are saying that you would go in, that wouldn't work like that. But I will allow Dr. Peters to respond.
Okay. Yes, we would recommend for persons who have chronic underlying illnesses, the diabetes and hypertension, to stay away from crowded areas and so on. So if you don't have to go in those areas, it would be best. In terms of staying home as a member of staff, no, we can't. We will try, or the workplace will try its best to make sure the area is ventilated and so on, and that it's, so we would make that recommendation.
Sorry.
No, no, what is about that?
Tracian is asking, is MyCAF currently cutting back on certain services in order to lessen the amount of staff that comes into contact with clients? I probably asked the principal director to answer that one.
Cutting back on any service.
What we have asked is that for those services that MyCAF provides, where the customers can use online access, that you bolster those avenues or those access points. Because if you don't have to see the person's face to face, it is better for you with this virus. However, there are some services like inspections, like the BRAs, where you have to physically inspect. Right now, we're guided by the Ministry of Health, those guidelines that Dr. Peters articulated about protecting yourself, keeping the 3 feet distance, and so on. But we don't have any position right now to close all businesses. We do not have such directives. So business continues. Right. So Dr. Peters, I don't know if you have anything to add to that.
No.
Okay.
The bin in bathroom is open on the first floor. Okay, I think we'll have to adjust. Is that the one at St. Lucia or here?
I think it must be St. Lucia, I'm not sure.
All right, so we note that and
We note it.
wait, right, okay.
So we'll look at it.
We are currently trying to procure hand sanitizers. That's Anna K Crawford. Is that National Fisheries Authority?
Fisheries.
So I guess from what I heard, we can just advise the staff of what exactly. So I see where you are fitting in on the presentation.
Yeah.
All right.
But just bear in mind that in terms of washing their hands, you're talking about dealing with a customer. It depends on what the nature of the service that you're carrying on with the customer, because if it is just stamping a permit or something like that, it's not possible for you to go to wash your hands immediately after each. So go ahead and continue to procure your hand sanitizer if you can get any, and alcohol.
Yes.
And so that in the interim, so you may decide that every hour I'm going to go wash my hand with soap and water, but in the interim, I can use at my desk, hand sanitizer or some alcohol.
That's for you. That's you, Dr. Peters. So the rest of my staff, Lily Claire, saying the rest of my staff are exposed to those who were secondarily exposed, and they are quite fearful. Not need to say out loud.
Not need to.
So I don't know if you want to speak to
yes.
that.
What the Ministry of Health is doing for persons directly exposed to those who were
Secondary.
Oh, that even makes it worse. Then it means that all of us would fall in the category that you now talk about. Those exposed to those who were secondarily exposed, and they're fearful. No need to be afraid. All we're asking, and everybody here have expressed, social distancing, the disease is not transmitted in that way. Practice good personal hygiene, washing your hands frequently, don't touch your face, and so on. That's the most you can do. This disease is not a death sentence. Yes, we also hear anecdotal stories that Black people have not been dying from this disease. It may very well be so, because quite frankly, I know the health staff is doing their best, even though there has been, negative reports of some, treatment of persons suspected of this disease that is not becoming of a healthcare provider. We have been doing fairly well in treating the positive cases, and they are all stable and on their way to being released from hospital.
Now, as a follow-up to Lily Claire's comment there, of course, the persons that were secondarily exposed, if they were not infected,
Mhm.
then apart from the fact that and that's why it is important in terms of the washing of hands, etc. But if they were not infected, then they wouldn't be transmitting by way of droplet infection, etc. So, but as we stress, it is keeping the social distance and ensure that we sanitize as much as possible. Don't touch the face. Again, over and over and over again.
Right. But just
another point is that based on what the World Health Organization has informed us, is that persons who are not displaying any symptoms of the disease, that is, they are not coughing, sneezing, or having shortness of breath, have not been shown to be able to pass on the disease. So that also should be comforting, because you're saying those were secondarily exposed, and so they were not necessarily showing any signs and symptoms of the disease, and so they wouldn't be able to transmit the disease. So that again should be comforting.
Oh, I wanted to say that on that same case that Linda Claire is talking about, that one of the persons who was infected with the COVID-19 was in direct contact with some members. Those members, we recommend that they be quarantined.
And also to call the Ministry of Health.
What is the current unofficial number?
They said they did.
Mm-hmm.
They said they did call,
1-8.
and it was recommended that they
You want to mention, repeat the number for
1-888 One Love.
One Love.
And there are some
1-888 One Love. And if you go online at the ministry's website, there are
some other
yes,
numbers.
and in the media they have published a host of numbers. There are also same numbers.
And there are persons manning those lines 24 hours.
We're self-isolating. The care saying we're self-isolating, but the other staff who were with us at that meeting are in crisis.
And what is, we are self-isolating? We who are these we?
Okay, so she's talking about the 8. One of the persons who is infected currently, confirmed, was in direct contact with 8 persons. Those, the Ministry of Health recommended that those 8 persons go in quarantine.
And some of them are in quarantine at home, and some, depending on the home situation, whether they have self-contained bathroom and room. So it depends, and they have running water and so on. Those persons would be quarantined at home and be visited twice or so per day by a healthcare provider who would take their temperature and make sure that they're still in good health. And for those who do not have such a facility at home, they would be quarantined at one of the facilities that has available space.
But you keep speaking about the ones who came in contact with the 8, but knowing that the 8 may not have contracted it, we would just recommend that they practice those safe methods.
Yes.
Because it's not a given that the 8 members will contract.
Yes, and should in case they notice any signs, immediately. Right. If you notice any fever,
go to a health facility.
Right.
Go to a health facility, or you can call the Ministry of Health emergency line, or you go to a doctor or a public health facility.
But no need to fear, no need to panic. Tanisha Facey, colleagues, I want to go back to the initial question of staff with chronic illness. How do you propose that we treat with these staff, the ones who medical condition require constant and structured care, or, for example, weekly visits to the hospital, etc.? I think those are like one kidney dialysis.
What do you treat with them?
Well, right. Well, I guess the question is, it would appear the question is trying to gauge from you, given what is happening, they would be more highly susceptible
Yeah.
or
Yes.
vulnerable to
So
contact.
what should they do? Do they stay at
And
home?
what is it that you are?
What is it? The ministry is
Ministry of Health,
no. The Ministry of Health can only suggest that if these persons would be certainly at higher risk in the workplace, but in the workplace we don't have any cases per se. If that person requests some alternate arrangement working from home, it may be considered on a case-by-case basis, but there is no blanket, carte blanche recommendation for those members of staff. It has to be a case-by-case basis where the person may be at extra risk because in that facility somebody was diagnosed with this condition and seek possibility of arrangement, if not instructed, to stay home or stay out of the facility where the risk would be lower.
But such risk is not just in the workplace.
Yes.
Because it can be in the supermarket.
Yes.
It can be outside.
Yes, and we understand that. It's a valid point that Tanisha has raised, because we see where, for example, in the United States, that they have advised persons in that category and elderly persons to remain at home and don't get exposed, because the potential is out there of being infected. However, in our case, I know that we have been looking at whether work from home depending on the circumstance. And it goes back to the point where if the ministry is going to say, for example, if someone in an area, say IT or other area where a person can work from home, they fall in a very high risk category. I'm sure that the Ministry of Health will be willing to, the ministry, MyCAF will be willing to look into those situations to see if such person can work from home.
So as you said, case by case,
Yes,
and maybe a recommendation from your medical practitioner.
Right,
I don't know, case by case.
It will be a case by case basis.
So yes, the webinar is being recorded, Authoring. Dr. Peters.
Is it possible for you to pass by my office the ones who were exposed?
The ones
She's saying, okay, the secondary ones, not the 8. The 8 are in self-isolation, but the rest of them at the office. She's saying, is it possible for you to give them a little talk?
You mean where?
The secondarily exposed ones, her office, the Jaipur office.
Yes, it's not a problem.
Not a problem, Lily Claire.
Okay.
What is that?
She said at the office, yeah.
I heard that they found someone.
In Kingston 20.
Area.
Yes, that was the person, well, I think you're talking about the person that came back from Trinidad, from Carnival, who visited the Kingston 20 area. I think the Ministry of Health has taken full charge of that investigation. I think they are trying to now find the potential contacts.
Persons go home.
Yes.
Yes, persons can go home. They can go home when they're not keeping people who live there out of their community. But it is possible, based on the number of cases, the contacts that may have been identified and showing positive, they may very well quarantine the area. I'm not sure. It depends on the decision will be taken at the highest level today. But you can go home.
But the thing is, the question about can persons go home is not clear, because is that you're speaking about persons that live in Kingston 20 area?
Yes. If it is safe, is the question, is it safe to go home? Or is the question, can we leave work and go home? Which one? That's a loaded question.
Yeah, it needs to be, you need to be more specific. If you live in Kingston 20, you want to know if you can go home.
If it is safe to go home, or you're saying, can we leave work and go home now? Please clarify what the question is.
Yes, I live in Kingston.
She's asking if it is safe. So I think Dr. Peters just answered that yes, it is okay to go home.
Well, of course.
At the end of the work day.
Yes, and of course, if your area is now being screened, then you would have to pass through that Ministry of Health /security questioning session, because they would want to make sure that you are okay, that you were not exposed, and that you're not going into an area where you are going to be further exposed. So I think it's only in the interest of the safety of all persons that are in that area to prevent further any infection or spread.
So yes, you can go home. The yellow tape is there, and there may be security place for you to verify that you really live there. Because at this time, in order to screen the area that you really live there, they don't necessarily want visitors to the area until they are able to screen and they are going to have those persons monitored. So they don't want any undue visitors. But go home afterward, no problem.
They want to make sure that she was.
No, but even so, they will find that out.
I think those are all the questions.
Yeah, thanks.
But no.
It's the same place we were.
Any more questions?
Click on the Q&A. Let me see if it's different from the chat. Can you click on okay, let me do it.
Q&A. Oh, okay. Will government office close as part of the precaution? Too early to say.
No, they say that you have to type answer live. Okay, so for those persons, we await any such instructions from the Prime Minister. Later
right. We'll wait that update.
Yeah, we'll have to follow the instructions from the Prime Minister and his team, including the Minister of Health and the Cabinet, of course. What are the risks for persons who have autoimmune illness such as rheumatoid?
Yes, you're at more at risk for contracting this virus because your immune system is compromised to some extent. And so, yes, you should be careful and be extra cautious and take the precautions.
That one was answered already.
Yeah. Go down.
Is there?
No,
what is the protocol? Right, so we did that already. Secondary exposure. Okay, we did that already.
Yeah. Okay. Hold on. She's asking if the presentation can be made available for wide circulation, Dr. Peter. Yes?
Who is that?
Lily Clay.
Oh, Lily, okay. Okay.
Yeah.
That was
answered
already. And is it about age and that was answered. My question: how persons have tested positive to corona? Okay, that was answered.
What happens if the person is located in not properly ventilated area? I don't think that
what
was it answered?
Which question was that?
That one. What happens if the area that the person with
this one here?
Yeah.
It's not properly ventilated.
If the area that the person with a chronic illness is located
is not properly ventilated.
Steps should be taken to improve the ventilation. That's the most that can be done.
Well, I think at one of our locations at St. Lucia, it's not our building and those windows cannot be opened. So I think maybe they are asking.
Cleaning staff should clean elevator buttons also more often. Canteen workers should be wearing masks while they cook and share means, hope guidance the location I am referring to.
Well, Dr. Peter spoke to the issue of masks already, so we need not go over that again. She's saying only those who are showing signs and symptoms of any coughing or sneezing or any other respiratory illnesses that should be wearing masks. As for the
And
cleaning,
if they're, and as a matter of fact, if they're sick, they shouldn't be at the
and
work.
if they're sick, they really should not be at work.
Yeah.
However, the cleaning staff, we have had a briefing with them. They have been directed to clean every hour, to sanitize those areas every hour on the hour. So if that is not being done, please let us know, because they were advised to do so.
All right, Sasha Gay, you have asked a very important question in relation to commute. Well, I'll extend that to public commuting in general. And so that, you know, I'm sure that the Ministry of Transport would need to also come in here in terms of, I think JUTC has implemented their strategy in terms of sanitization, right? And the passengers themselves will also have to walk with their little sanitizer in case they touch the seats, the handle, etc. Now that it's a difficult call because you're in a bus loaded with persons, and God forbid then one person in that bus is infected, then you know the persons are at risk. So it's just a matter of how best do we keep. I don't know how you're going to implement a social distance in a bus, and these are some of the questions which are not very easily answered, you know, but just to keep safe. I mean, if you go in a bus and someone in there is coughing and sneezing and you don't, then come off at the next bus stop. I'll do that.
Or put on your mask. In that case, put on your mask. Because you can't help yourself.
Yes.
But if you are, I would say that public transports are, you know, high risk for transmission. So if you don't have to use them, avoid it. If you don't have to go anywhere, then don't go.
If it's 2 bus stops down the road, then maybe walk.
Yeah.
You know, we don't know. Yeah, it's a difficult call because we all have to. Some of us all have to take public transport if we don't have our own. So I mean, we are depending on the operators of these public passenger vehicles to put in place their good sanitization practice. You have anything to say about that? Okay, the next question. How long after sanitizing a surface is it safe to touch?
How long after?
Yes. How long does the sanitizing agent take to work then?
Well, immediately after, when you sanitize a surface, you're cleaning it from germs, and so any immediately after you've cleaned, then you know it means that that surface, if exposed again, can be contaminated. There's really no time. There are some chemicals that, you know, are residual for a period of time, but alcohol dissipates quickly. So in terms of the chemicals still being effective for an extended period, I am not necessarily aware of bleach.
Yeah.
Bleach.
Yeah, you need for contact time. Yeah, for example, if you use bleach, it maybe allow for a few minutes, you know, for proper sanitizing to take place. I mean, most of these things, they're going to act on contact, but you still allow for some time.
All right, so we're going to have to wrap up.
We're going to give.
There's a question here that says, why have we arranged? Look over the Q&A side. Look over the Q&A.
Q&A over here, okay. Why have we arranged that sick leave, departmental leave, vacation leave used for those who are ill why did we not arrange a special leave for 2 weeks for persons who are ill?
Yeah, I don't understand that question. Because are we talking about COVID-19? Because if you're infected with COVID-19, then the ministry will write for you to have special leave. If you're sick as you are normally, like normal sickness, then you would apply for your leave as you normally do. I'm not sure I understand the question.
Yeah, that question is not clear. The question is asked about how long the virus lives outside the body or on surfaces. I think Dr. Peters had spoken about that, yeah, but at first they said it was about 6 days. Now we're hearing that it can go up to about 10 days. Right.
So it started off with wait on days.
So right, so it's just a matter of ensuring that you sanitize. Don't take it for granted. Sanitize the surface. I think.
Yeah.
Okay, hold on. Someone is typing. Yeah, we are winding down.
We're actually finished. We really want to give a big thank you to Dr. Peters and her support. What's her name again? Dr. Ellis. We want to thank them so much because we know they are in very high demand and they have found it, important to meet with you and to take all your questions. So I know you will join me in expressing great appreciation to the Ministry of Health and Wellness for supporting us, in particular
Dr. Peters.
Dr. Peters and
we are from
yes.
Okay.
All right. So thanks for joining. And if you have any questions, don't be afraid to send them later. We will get the answers for you.
And there's a Ministry of Health.
There's a Ministry of Health's website. Please monitor.
And also the
and please follow the updates that are given by the Prime Minister and the Minister of Health. They will further guide all of us.
Dr. McLennan, we were going to release Dr. Peters, but Dr. McLennan, for those who wish to stay on, she's going to show you a demonstration of how to use the hand sanitizers and all those. She has a little basket with her, so for those who wish to.
Yes, so don't leave. Dr. Miguel is going to show you
so much,
some demonstrations here now.
No, we're not going to do the actual washing. Get one? Buy one. All right. No, man, it's fine. All right. It's muted?
It's not muted.
No. All right. Good afternoon. Quickly, for just for a few more minutes of your time. I know it's past lunchtime. All right. So just for a few reminders, you'll be getting the presentation, but we got our advisory from Ministry of Health and Wellness, which is what I just have here in my hand, and it's saying for us to try and keep a safe distance of 1 meter from all persons. Try as much as possible. For the customer service persons, I think that is very important. Most of you are either across from a desk or you have a glass screen in front. Dr. Ellis is beside me, and just to help persons, what is 1 meter or 3 feet? Or 3 feet? How can we show them the extent of this? That's fine? There's some stuff. All right, good. Right, so if I was to stretch my arm, this is 3 feet right now, and Dr. Ellis was to stretch her arm, that should give you an idea. I'm going to move the tape now. So if we were standing, I was facing her and she faced me, that's about the distance, normally. And usually for customer care persons, you normally have a desk or a glass in front. So you should be okay. If, however, you have persons who are positive for COVID-19, it now moves from 3 feet to 6 feet. So that should show you the extent of when the person is confirmed, it's a totally different operation after that. All right. I have my little basket. I have a little basket with me. A lot of persons realize that now hand sanitizers are out. So if you do have, you need to use a good amount only if your hands are clean. If your hands are dirty, you need to wash them with soap and water. You need to wash them. We can't emphasize it that much. So you have your soap and your hand sanitizer and Lysol, if you can get it. I think it's going off the shelf very fast. And of course, I bought my little spray bottle, and in it is 70% alcohol. So I can do my own personal things. You have your office thing, but your responsibility to protect yourself is with you as well. So you need to have your little things to make sure. I want to talk about the mask quickly. The surgical mask, not going to help you. And as Dr. Peter said in our presentation, it's only for persons who have to be in contact with persons who are positive. Healthcare workers, maybe the family members before they are taken to the hospital. And the only mask that is used is these thick ones. It's N95. They're very special ones because they have filters in it and they're very thick. So buying these is not going to help you. All right? I want to do the hand washing very quickly. When I presented to our staff at Vet Services Division, everybody was saying, including myself, we don't spend time to wash hands. But when you're washing your hands, say the alphabet. That's 20 seconds. You're going to wet your hand first, then you'll get your soap, enough soap to lather it, right? And then you're going to start inside, wash, then inside, in between, wash, and then you're going to wash the back and wash the back. Then you're going to wash here, and then you're going to wash here again. So, and then fingernails, you're going to wash in between, and therefore you're finished. Now you can rinse your hand, and of course this is an issue that a lot of persons have. When do you go for the paper towel? Let's say in the bathroom you don't have any paper towels to go for. I would suggest that you wash the turn-off pipe with soap and water as well, right? If you have bleach inside there, you can also squirt it. But you need to wash off everything before you even wash it off and then wash again. But if you finish washing your hands and you have the paper towel, then pull the paper towel, dry off your hand, then you turn the knob and throw it in your bin. And we're encouraging you to line your bin. So when the cleaning staff comes, all they have to do is tie up the bag and throw it away. All right? The tissue, when you're using tissue, please don't use your rag if you have a cold or you're coughing, because you're basically reinfecting yourself. You have your tissue, that's why Ministry of Health and Wellness advising tissue and WHO. Once you take out the tissue and you have it during your sneeze, and you're going to throw it away, right? Sometimes I walk on with my bag, so I can put it in here, I don't really open it, just open and throw it, lock it back, and then I throw away everything, right? If you don't have access to it. If you're coughing and sneezing normally, you do what Ministry of Health and Wellness says, cough in your sleep, all right? Or cough on your clothes. These are things, I think that's about it, right? Everything else, head office will send to you in terms of the procedure and what to do. All right, thank you very much for listening to me.
All right, we want to thank you so much for your active participation, and please, as they have indicated, be guided by the information on the Ministry of Health and Wellness website. Ms. Latibadere is also sharing information as they become available from that website. And stay tuned, we should be hearing from the Prime Minister. I don't know, they said later today?
Later today.
On any updates as it relates to what will happen to businesses. So stay tuned for that information. Thank you again. If we have any more information, if we can get the Ministry of Health again, we will certainly get them to update those who missed this session. You wanted to say something, Doctor?
I'm just encouraging everybody, do not panic. Just get this information, prepare yourself, follow proper hygiene, and just keep everybody calm. We will get through it. We have supportive treatment if you go through like a cold, so they will be okay. As long as we get the information to the Ministry of Health and Wellness right away. Please do not panic. We will ride through this.
All right. Thank you so much, colleagues. Have a wonderful day. You have a question? There's a question on the side? Is that for this team?
No.
Okay. All right. Have a wonderful day, colleagues.
Bye.
Bye.